Well, hey, everybody, this is Robert, and welcome to today's newscast. This newscast is going to take us down to Melbourne, Australia. And the Victoria Department of Health has identified an outbreak of Legionnaires disease with significant increase in the number of cases across multiple locations in metropolitan Melbourne during the past 10 days. To date, there have been 78 confirmed and 10 suspected cases notified since Friday, July 26, mostly in adults aged over 40 years. All cases have visited or resided in metropolitan Melbourne. Most cases have required hospitalization, with multiple admissions to intensive care for severe community-acquired pneumonia. Investigations and control measures are underway to identify the source of the outbreak through testing and disinfecting of local cooling towers, primarily in the Derrimut and North Laverton area. To date, officials have tested and required the disinfection of cooling towers on 58 sites, with more visits planning in the coming days. Well, test results indicate the outbreak is caused by Legionella pneumophila serogroup 1, which can be detected through a Legionella urinary antigen test. Now, Legionnaire's disease is caused by Legionella bacteria, which are widespread in the environment. Legionella is found in natural bodies of water such as rivers, lakes, creeks, and hot springs. It is also found in spas, warm water systems, and artificial systems that use water for cooling, heating, or industrial processes such as cooling towers, as well as potting mix. So, who's at risk for Legionnaire's disease? Well, although Legionella bacteria are commonly found in the environment, only a few people who come in contact with the bacteria become infected. In this particular outbreak, most cases are arising in people who are normally at greater risk of infection. However, there are also cases in otherwise active and normally healthy adults. People who are at the greatest risk of infection include those who are over the age of 40, they're smokers, they may have chronic lung disease, they may have a weakened immune system, or they have other underlying medical conditions such as chronic heart, liver, or kidney disease, and diabetes. Now, Legionnaire's disease usually presents as a chest infection with symptoms such as fever and chills, cough, headache, muscle aches, and pains. Other atypical symptoms may include confusion, nausea, vomiting, and diarrhea. Some people with Legionnaire's disease may also develop kidney impairment. Legionnaire's disease can lead to serious illness, and cases may require hospitalization. Legionnaire's disease is spread by breathing in fine droplets of water that contain the Legionella bacteria. It is not commonly spread person to person or by drinking contaminated water. Now, health officials in Victoria, Australia, advise people who live in, work in, or have visited metropolitan Melbourne and the surrounding areas and develop symptoms of Legionnaire's disease to seek urgent medical care. They also advise the following for healthcare providers. 1. Consider Legionnaire's disease in patients presenting with compatible symptoms who live in, work in, or have visited metropolitan Melbourne and the surrounding areas. 2. If you do suspect Legionnaire's disease, request urgent urinary antigen testing through your normal laboratory provider. As a priority, order Legionella culture and PCR on sputum or other respiratory fluid samples. Serology can be requested on blood at symptom onset and 3 to 6 weeks later as convalescent serology. Early diagnosis and treatment with the appropriate antibiotics is important. And lastly, operators of cooling towers in the metropolitan Melbourne area are advised to ensure compliance with their cooling tower testing, servicing, and auditing requirements. Thanks for listening.